So I did actually work in long-term care at a university for about 2 years, and then got into medical device sales from there. So I've been doing this now for about 10 years in total. So I'm based in Halifax, but originally from Cape Breton. I like to keep that out there. Still a Cape Breton boy at heart, but I'm based out of Halifax, and I cover the province.
All right, so I'm going to go ahead and share my screen. Everyone just bear with me for a sec. Let's hope this works. Center mode. All right, can you see it?
Yep, we're good.
Awesome.
Okay, so I'm going to start by talking about the Sage boot. So I'm not going to take a whole lot of time because the majority of the talk is going to be around Cassie's presentation. But I did want to talk about the Sage offloading boots because they are listed on the formulary, and it's a product that is sold exclusively through Cardinal. So there are 3 different sizes, and I'll get into the sizing and the different sizes. But we do stock all 3 boots in our local warehouse in Moncton. So everything ships from Moncton and ships directly to your facility. So the main point I want to stress, a couple things, is how to apply the boot properly and how to maintain the boot. Because if you're not applying the boot properly, you're not going to get the desired outcomes that you're looking for. So when you get your boot, you'll see it like this out of the package. The first thing you're going to want to do when applying the boot is have the resident or patient laying on a bed or sitting on the edge of the bed, and you're going to turn the boot inside out. So this is the inner part of the boot. You can see this gray material. It's called dermasuede. It's a material created by Sage, and if you feel the material itself, it's quite soft, but it also has quite a bit of grip to it. And the reason for that, it's going to hold the limb in place so that the foot is not moving around inside the boot. So it sits nicely in this pocket that you'll see here. So this is where the heel will sit. So when you're putting the boot on, try to place the heel directly into that pocket. Might be easier to show it like this. So right into that hole. And once the heel is in place, you're going to wrap the boot around the foot. So I always say to have a little peek in that hole once the heel is in place, and just give a little tug up on the toe of the boot. It helps drop that heel down a little further. And if you can see the heel in that pocket, then you know the boot is put on properly, or the heel is in place properly. If you see the heel sitting up inside the boot somewhere and it's not completely offloaded, you should take the boot off and reapply it again, because again, you're not going to get the outcomes you're looking for if that heel is not visible in that pocket there. So from there, you're going to start applying your straps. So we have 3 Velcro straps. So the first strap is this large black spandex strap. So the straps are made of a spandex material. It's very stretchy, soft. There's no ridges or creases or edges. So anyone who has edema or a sensitive skin, they're not going to get a device-related injury because of the boots. So again, you're just going to put your large black strap to your black Velcro panel. And then you have a white strap that attaches to your white panel. And then the third strap is your contracture strap. And here it is here. And that wraps around the bottom of the foot and helps keep the foot in a nice upright neutral position to avoid that drop foot contracture that can happen. So once you have your boot in place, again, just have another quick peek in that hole and make sure the foot hasn't moved around while putting the straps on. And then you're going to put your wedge in place. So the wedge is designed to go on the side of the boot to help keep the foot in a nice upright neutral position to avoid the rotation that happens when people lay in bed. So for example, if this boot was placed on the person's right foot, what tends to happen is the foot will rotate laterally outward or externally rotate. And to avoid that, you put your wedge in place on the right side to keep the foot upright. Now, there isn't a left or right for the boots. They can be put on either foot. But again, you just have to put your wedge on the right side, depending if the boot is being worn on the left or right. So the wedge can be put on either side. And once you have your boot in place and it's applied properly, you just want to make sure that the boot is being maintained. So proper cleaning would be just use soap and water with a face cloth and dry off with a soft dry towel to clean it off. You're mainly going to want to clean the inside of the boot and the dermis wage. That's where the skin's going to be contacting. One thing I really want to stress is do not put these in the washing machine. They are not machine washable. If they go in the washing machine, they're not going to come out the same way. What you'll see happen is the gray material will lose its grip, which then causes the foot to move inside the boot, and it's not going to grip the limb properly. Also, the Velcro will lose its grip as well, so the straps aren't going to hold as well as they should. So I do want to talk about sizing as well. So if we can go back to that sizing chart. So there on the right side, you'll see there are 3 different sizes. There's a petite, standard, and XL. So when you're looking at the sizing, you want to measure the calf circumference. So take the largest or the thickest part of the calf, measure their calf circumference, and that will give you the appropriate size that you should be looking at. So for a petite boot, it will fit a calf circumference of 5 to 10 inches. A standard will fit a circumference of 10 to 18 inches, and the extra large is 18 to 25 inches. So again, with the proper sizing, if the boot is sized properly, then the foot's not going to move around inside the boot if it's sized appropriately. If the boot is too small, then you really have to struggle and try to tighten those straps up as tight as possible, and it becomes a little awkward. So you really want to make sure the boot is sized properly. Other than that, the boots should be worn as much as possible. So they can be worn in bed, worn in a wheelchair. The more they're worn, the better. The only time these aren't effective is if, again, they're not put on properly or they're not being worn. So the more they can tolerate, the person can tolerate wearing them, the better. Another thing I want to stress is that these are single patient use, so they are designed for one person and one person only. So if someone is prescribed this boot, it is for them. It's not to be used with other people in the facility. They would have their own boots. So is there any questions on the Sage offloading boots?
Hi there. If you have any questions, just take yourself off of mute, and I'll have a quick peek at the chat box there, Dave.
Okay.
And no questions in the chat box either.
Great.
All right, it's on to Cassie. Thank you, Dave, very much.
Thank you.
And thank you, Sherry. I see you've made an appearance again. We missed you.
Sorry, I was running late, trying desperately to get on time.
No, it's no worries at all. Bernadette filled in perfectly.
Great.
All right. So as we said, or as I said, my name's Cassie. I put my email address here as well as in the chat box as well. I also put Dave's there. If anyone has any questions at all, feel free to reach out to either one of us. The other thing is, if you need a certificate for attendance for this session, you can shoot me an email and I can send that off to you. So this session is on a couple of products that are on the formulary now, and those are AMD, antimicrobial dressings, that have PHMB in it. So PHMB stands for polyhexamethylene biguanide. I'm not going to make everyone learn that, so that's why we call it PHMB, because that is quite a mouthful. So we'll move along here. So what is an antimicrobial? We'll start with the basics. Antimicrobials are any agent that kills microorganisms, stops replication, or inhibits pathogenic action. You might hear the suffixes cidal or static to describe a little bit more specifically how they work. Cidal killing the organism, and static is just preventing or inhibiting growth. So PHMB is bactericidal, meaning it kills the organism. In your practice, you've probably seen a lot or most of these antimicrobial types. So there's PHMB, iodine, methylene blue or gentian violet, hydrophobic antimicrobials, honey, and silver. All really great products, all different types of antimicrobials that work different ways. This is my favorite slide talking about when should I use an antimicrobial dressing. There's often a lot of questions around this, and this graph does a really good job. So in the contamination colonization phase, just watchful waiting. And then when you start to move into the local infection, that's when you would start using a topical antimicrobial. So that's when that bioburden is starting to increase. Then if it moves into spreading or systemic infection, you can still use a topical antimicrobial, but along with a systemic antimicrobial as well. So antibiotics or something like that. PHMB or antimicrobials are also really great in preventing infection. So using it prophylactically, PHMB in particular doesn't build up resistance. So using it in patients that are a really high risk of developing infection in their wounds. As well as, of course, using it in those stages of localized wound infection or with a systemic antimicrobial as well. All right, and two of my favorite memory aids, mnemonics there, nerds and stones or stone-ease. I think it's changed depending on how you learned it. Might be stones, might be stone-ease. So nerds is about the systemic or the superficial localized infection. So N is for non-healing wounds, E is for exudate increase, R is for red and friable granulation tissue, D for debris on the wound, and S is for smell, so increasing malodor. For a deeper or systemic infection, that's where stones or stonies comes into play. S is for the size is increasing. T is for temperature and increased temperature, increasing warmth. O is Latin for bone, so probes to bone. And N is for new or satellite areas of involvement with the wound. E can stand for exudate, erythema, edema, any of the above. And S, smell, again, that increasing malodor. So what is PHMB? What is it about? It is a positively charged ion. Bacteria are negatively charged. So what PHMB does is uses that positive charge and attracts the negatively charged bacteria. It attaches to the cell wall, lyses the cell wall, the internal components of that bacteria leak out, and then all that's left is the shell of the cell that then collapses, it dies, it can't replicate, it can't mutate, it is gone. It kills in the dressing, not in the wound bed, so it attracts it into the dressing. And within that dressing, all of that bacteria is dead, so it resists colonization within the dressing, so you're not going to get mutations within the dressing itself. It's very broad spectrum, so it kills all the usual suspects, including VRE, MRSA, Pseudomonas, fungi, yeast, all that good stuff. PHMB is really effective against all of those. It's safe, low toxicity. It's been used a very long time in a number of products, so things like contact solutions, cosmetic products, pool cleaner. It is in a lot of different things, and it is hypoallergenic as well. It kills bacteria without harming tissue or without disrupting good tissue. So it just focuses on that bacteria. It's not systemic, so it's not absorbed into the bloodstream, which makes it safe for pregnant or breastfeeding women. It also makes it safe for neonates as well as the elderly. So really throughout the lifespan, PHMB is a very safe product. It doesn't slow the healing process at all, and it will still work in the presence of blood or protein and will not irritate the skin. So moving into the specific dressings that are on your formulary that contain PHMB. So thinking about how to use it, it's another tool in your toolbox, along with all your other dressing supplies, all the other antimicrobials out there. And a really good memory tool to remember when to use it is SET. So S for skin folds, E for exit sites, and T for tunneling. We'll look a little bit more into those uses. So the first thing we'll talk about is Curlix. Curlix comes in a roll like this. It also comes in sponges, so gauze, a little pack of gauze there. It is a cotton-based gauze. It is sterile. It can be used wet or it can be used dry. It's hypoallergenic. And where it does kill in the dressing, it limits cross-contamination. So from the outside environment into the wound or from in the wound out to the environment to protect the care providers. When can you use it? Skin fold complications, acute or chronic wounds, large wound areas, surgical wounds, burns, first and second degree, wound packing, and it can also be used with negative pressure. So here are some pictures. So the good stuff, skin fold complications. So anytime you're seeing some skin breakdown, some yeast growing, this stuff will be your best friend, especially in a long-term care type environment in the summer. You know, the temperature is often pretty warm, things get moist in the skin folds. You can use Curlix in those areas. You might need to change it once or twice a day if it's especially bad at first, if there's a lot of exudate, if the dressing gets damp, take it out, put a new piece in. Depending on your facility's infection control policies, these gauze rolls can stay in the client's room and you can cut off a piece as you need it. It is pretty inexpensive as far as dressings go. It costs between $2 or $3 for a roll of this stuff. So you can use it, like I said, in skin folds, and it stays quite nicely because it is just a gauze texture. It has a little bit of grip to it, so it stays quite nicely in those areas. Another use for it is contractures. So sometimes with contractures, especially if there is some moisture in there, there can be a bit of an odor. You can get some yeast, you can get some buildup. So there's a couple different ways you can tackle it. You can use a whole roll or some portion of a roll, or you can wrap a little bit of the Curlix around a face cloth, a couple layers of Curlix around a face cloth, and then stick that in the hand. And that will actually really decrease odors as a rule and help prevent bacteria from building up in those contractures. Another use for it is under compression. So lymphedema cellulitis, I like to use it for legs. So legs would have a lot of pinpoint ulcers on them. Really hard to get good coverage of that. You get a big gauze roll, you kind of fan fold it back and forth over those areas, make sure everything is covered, and then it can go under your secondary dressing, and that way all of those spots are covered. And large surgical wounds or pressure injury cavity. So as you can see in that picture, it's great if it's a large area. There is a lot of gauze in this roll. So you can use it for those types of things while getting the antimicrobial benefits. We'll move on to the Curity packing strips. You might be familiar with these. The packing strips and the gauze both are effective for up to 3 days. So the packing strips, there are 3 different widths, 1/4 inch, 1/2 inch, and 1 inch. They all come in 3-foot lengths, a standard length. They come in an individual package. So there's not a ton of waste. You just take in as many little packs as you need. And they can be used wet or dry. It comes dry. It has really good tensile strength. You can see me kind of yanking on it. And it maintains its integrity. So if you are packing a wound with this, you can trust that it's going to come out in one piece, really good tensile strength. If you need longer than 3 foot, you can always tie 2 together if you need with a really good knot. And of course, they do come sterile as well. So what are you going to use it for? Acute and chronic wounds, pilonidal sinuses, diabetic foot ulcers, open tunneling wounds, surgical wounds, or wounds that require vertical wicking. So if there's exudate in a tunnel or something like that, these packing strips will help wick that moisture up into a secondary dressing, whatever you might be using. And some pictures. So tunneling wounds, so you can lightly pack those wounds to help support the walls. Again, always remembering to leave at least 1 inch of the packing strip out. So the person who comes along behind you is aware that there is something in that area. We always say to leave a little bit more than you think you should, because you never know what's going to happen with that tunnel. It could get bigger, it could open up into another cavity. So leave more than you think you should in case a little extra gets sucked in, just so the person coming along behind you can make sure they get that out. I like this picture of the diabetic wound. So the between toes, that's one of my favorite uses for this. If you have somebody who gets a lot of moisture in their toes, often diabetics, looking like it might be getting a little bit of fungus there, you can actually take the PHMB and weave it through their fingers or their toes. It helps wick away the moisture and keep things dry, but it also can help deal with any kind of bacterial burden that's building up in those moist areas. And diabetic pinpoint foot ulcers with the different widths. It's really great to pack in there, keeping it kind of flat so there's no bumps, and then securing it with a secondary dressing. So again, hold it in place, but also absorb any exudate that may be there. The packing strips can also be used with that memory aid of set. So E for exit sites. So around G tubes, J tubes, if you're seeing any irritation there, any hypergranulation, you can use these, kind of wrap it in that area, and it can help decrease the bacterial burden around there as well. Works great for those sorts of things. And here is just some of the papers on AMD with PHMB. It is pretty well studied. It is very effective as an antimicrobial. It's used in all kinds of places. You can see the veterinary nurse article there. I like that one. It's used in animals as well. Just kind of showing the versatility of it. But there's lots of studies. If anyone's interested in seeing any of these, you can shoot me an email. I think at last count I had 15 saved in a folder, different studies on PHMB. We'll move along here just to cover a little bit about negative pressure wound therapy. When you see NPWT, that's what we're talking about. So as you may or may not know, the VON has signed a contract to use the Cardinal Pro in their practice. And in long-term care, I know there's not a lot of negative pressure, but if for some reason you are going to be using it, you might see one of these systems pop up. So this is what it looks like. If you're familiar with negative pressure, often called VAC therapy, it is a trademark VAC, so that's why we call it negative pressure wound therapy. You might be familiar with some of the things I'm going to cover here. So why this product? We're not trying to replace the KCI product. They're awesome products. Just a different setting, So for in-home care, it's really hard to keep an eye on these pumps sometimes. In the hospital, they're attached to the patient. You know where the patient is. You know where the pump is. Not the case in community when people have a little bit more freedom. So that is what we have these lovely little pumps for. It is a disposable device. So it has a 1,000-hour lifespan. That is nearly 42 days. At the end of its lifespan, it gets recycled. These devices are really user-friendly. If you can see the buttons there, or in the picture, you can see that it is very, very simple. There's no complicated interface. The green button is for on, the red button is for off. You can see some arrows here that are for adjusting the pressure. There is a lockout function if you're concerned about those settings getting changed between visits. There is a continuous, it comes in continuous mode. You can change it to intermittent mode with the press of a button. And then there is a little screen here. This little screen, when you turn it on, it tells you how many hours the pump has been used for. So to keep an eye on how much more lifespan it has, how long it's been used for, keeping track of whether or not it has been left on between visits, those sorts of things. If there is an alarm, it will come up, a number will come up on this screen, and you can just look here, and it actually has a little legend about what those alarms might mean. So again, pretty simple for an interface. It is very lightweight. It's less than a pound, so very lightweight, very portable for people living their lives. It's also very quiet. We have had calls because people don't think it's working because it is so quiet they can't hear the suction, especially if you've got a really good seal, you don't hear it. But that's normal. If the light is on, it is on, and not hearing it is a good thing. The other thing is it has great battery life, so up to 24 hours. Again, if you've got a really great seal, 24 hours battery life. A little less than that if it has to work a little harder to keep that seal, but still a good long time. So for your residents or for people in community that are living their lives in the dining room, socializing with their friends, that sort of thing, it is good to have that extra battery life for sure. It is easily cleaned for multi-patient use. So where it has 1,000 hours, if say you have a client or resident that only uses it for 500, you can clean it, use it for somebody else. And that being said, if they need it for more than 1,000 hours, you get a second pump. So it can be used for multiple patients. It is a less expensive device overall, allowing you to have a little bit more resources, maybe more pumps, treat more people, and it's owned. So your facility or the VUN would own these devices. You still don't want it lost, but if it does get lost or something happens to it, it is a lot less expensive, and it's a little bit less tracking. These pumps do also have a lifetime guarantee. So if something happens, Cardinal will replace the pump. You just reach out, send it back, and we'll send you a new one. Another feature of these pumps is simultaneous irrigation. Really cool feature. We do not see it a lot. I've rarely, if ever, seen simultaneous irrigation used with negative pressure, but it does have the ability to do that. And it would make it accessible in long-term care or in the community, which is a different feature as well. Usually it's only in acute care. And this is just a slide that kind of talks about some of the different products that come with, or that it can be used with, the negative pressure. So again, if you've used a KCI or VAC device, some of it's going to look really familiar to you, specifically the foam. So a dressing kit comes in small, medium, large, extra large sizes. And in that package, you would get whatever size foam you chosen, the drape, enough drape to kind of cover the peri-wound skin and seal over the top. As well as the connection tubing that would connect from the dressing to the pump. That's what comes in a kit. Of course, there's other things. There are canisters. So you can see here, this is a 300 ml canister. This is the size that you are most likely going to see. There is a 500 ml canister as well, but it sticks out a little further. It would be kind of a special order thing. I don't think it's something you would see very often. But as you can see, the canisters also change very, very easily when it does get full. There is white foam as well. So a little different than the other white foams that you might be used to using. Ours actually comes dry and can be used dry as well. It is very soft. It's very flexible. I always compare it to a makeup sponge. That's what it feels like. It's very, very soft, like a makeup sponge. It can be used to cover any kind of exposed tendon, bone, that sort of thing. Also for reducing pain. If people are finding the black foam is uncomfortable, you can use some of that white foam as a contact layer instead. There are IV pole holders. I know in long-term care and in the community, nobody has an IV pole, but it can be used attached to wheelchairs or things like that as well. Each pump has a carrying case, really convenient. It is discreet. It is a small black case. You can still access the charging port for the pump. You can access all the buttons. And like I said, it is pretty discreet. That's where it stays most of the time, usually is in one of those carrying cases. There are Y connectors too. So if you have two wounds, want to connect them to one pump, there's a Y connector for that. There are bridging and offloading kits. So that's when, if you have an area of increased pressure, like a coccyx, and you don't want the port of the tubing to add additional pressure to that, you can offload it to a different area, say a hip instead, and the bridging kit can help with that. There are also irrigation kits. Again, don't see it a whole lot, but if you need it, it's available. And there are drapes for sensitive skin as well. Of course, there is always, nuances with a new product. So if you're in long-term care and you're saying, oh my goodness, I haven't used negative pressure in a long time, and a device pops up in your facility, reach out. I am more than happy to provide education on it. I will come to as many sessions as you need at whatever time of day. I know that it's not something you see a whole lot. With the VUN, we're rolling it out area by area by area, making sure that everyone has got some training and is comfortable with it before we move on to the next area. Just make sure that we are not throwing you to the wolves, and we will make sure that you are comfortable using this. All right, so there's my email address again if you need to contact me for any reason. But I'll open up to see if anyone has any questions. I'm just going to end the slideshow here.
So just